Welcome back, everybody, to another episode of Explain This. Of course, I'm with the star of the show, Robin Riddle. Robin, how's it going?
Great. How about you?
I'm doing wonderful, and we're going to talk about a very popular topic today, one that I know you guys have heard of, and that is high-dose vitamin C, introduced intravenously?
Yes.
If I'm saying that right.
Yes.
So, Robin, I'm going to let you take it away before I mess up any more pronunciations. Take it away.
Yes. Okay. So IV high-dose vitamin C. We all hear about it. I think it gained a lot of popularity, and everybody started hearing more about it during COVID because it is a great immune support. So it is becoming a lot more mainstream. So we offer high-dose IV vitamin C here in the office, and I just want people to know reasons to use it, what we're using it for. So first of all, what is vitamin C? It is a nutrient that we have to get from external sources. Our body is not able to make vitamin C. I'm sure everybody's heard of scurvy. I think of pirate ships when I think of that. But that's people who don't have enough vitamin C. You actually can develop a condition called scurvy from a lack of vitamin C.
Okay.
So obviously we're not getting a lot of that in modern day. Most people have access to enough, but that's what that is. So your body can't make it. We have to get it through supplementation. You can take oral supplementation of vitamin C, but any type of oral vitamin that you're taking, you're only getting 30, maybe 40% on a good day absorption of that vitamin. So it's really very difficult to get great absorption of high doses taking it orally. Your stomach just can't absorb it. It just pushes it on out. So we're not getting to the levels that we want. Okay. There has been research done on high oral doses versus high IV doses. And obviously your IV doses, you're getting extremely good absorption and blood levels spike the way that we want them to.
Got it, because it's going directly into the bloodstream.
Into the vein. We are avoiding all of the first pass and breakdown and all that kind of stuff. So we are getting, you're getting 100% of it where you want it to be whenever you do IV vitamin C. Okay. Things that we use it for. So it's acting as a great antioxidant. So we're reducing oxidative stress in the body. And then it's working with enzymes in the body to produce collagen. Okay. So collagen in your skin, we hear more about that thinking about like the tightness and beauty of your skin, which is great for that. You literally can like glow more after getting IV vitamin C. But it helps to reduce signs of aging, and it can actually help accelerate healing. So it can be used for wound healing.
Interesting. I did not know that about the collagen. That's cool.
Yeah, so boost the immune system, of course, which is what we really hear about it for. If you're sick or you've been sick or you're going to be traveling and you're worried about getting sick, high-dose IV vitamin C can really help with that. Also helps with mood. So you feel happier, feel better, helps with energy. It can even help improve blood pressure, actually.
Interesting. Vitamin C.
Vitamin C. Okay. High-dose IV vitamin C. All right. But then it's also been studied as an adjunct therapy for cancer. Now, it is not FDA approved as a cancer treatment, but there have been studies since the 70s in using high-dose IV vitamin C either as cancer treatment in some of the studies or as adjunct therapy.
Interesting.
Of course, we are not advertising or saying that we are treating cancer with high-dose IV vitamin C, but I do have plenty of patients that have sought this out as an adjunct therapy with the approval of their oncologist. So some studies have showed a slowed tumor growth with IV vitamin C. Some studies show actual cancer cell death with IV vitamin C. And other studies just show improved quality of life doing this. There's certain kinds of chemo that you can do it along with, and other types of chemo you have to wait till you're finished with chemotherapy and then do this to kind of bump things back up afterwards.
Interesting.
And so that's where the oncologist comes on board and tells you if it's okay or not to do as an adjunctive therapy. Okay. But we see reduced nausea, overall like feeling better using high-dose IV vitamin C.
It just sounds like such an amazing tool, this vitamin C, to have in your toolbox.
Yeah, absolutely.
In your toolkit. And one thing you're saying is high doses.
High doses.
Tell me what that means.
When I say high dose, your options are 25 grams, 50 grams, 75 grams, or 100 grams.
Now, can you compare that to what people see in the stores? Like, how much more is that?
Yeah. I mean, whenever you get down to the math of like the actual absorption, so your normal pills of vitamin C are 1 gram, 1,000 milligrams. milligrams.
Got it.
So, I mean, you'd have to take 25 of those pills to equal the dose, but then you're not going to get the absorption of those 25 pills. It's not a good idea. Don't do it. You'll be really, really sick. Don't try to take that much orally. It's not going to work.
Yeah.
But given IV, we're getting all of that directly into the bloodstream, getting out to the cells where we want it to be.
That's fascinating.
So a lot of times we always start people out low and work up. 25 grams is kind of my standard. That's what a lot of people do. If we're getting into using it for specific reasons, that's where we start going up on the doses.
Okay.
You have to have some blood work before we can do a high dose IV vitamin C. So a G6 PD and a CMP, comprehensive metabolic panel, is what we run pre-hand. If you have a deficiency in G6 PD, it can actually cause a hemolytic anemia if we give you high dose IV vitamin C. Not good things. So we have to have that level before we do that.
Okay. So you got to grab that level,
Yep.
and then, you know, figure out what sort of treatment. Is there like I look at this as a last minute, I'm going on a business trip sort of thing. How do people fit this in regularly into their life? Is that do people do that?
Yeah, I have some patients that come weekly or every other week, once a month. We have lots of different regimens that we can do.
Okay.
If you are like, hey, I'm getting ready to jump on a plane, I need something quick, and you don't have time to get the blood work, one of our Myers infusions would be better. It has vitamin C in it, of course, with the whole other vitamin blend, but it's lower doses of vitamin C, so we don't have to have the G6 PD because we're not getting into the doses that would be dangerous if you have that deficiency. So if it's a last minute thing, I can pop a Myers in, we're good to go. But the high dose IV vitamin C requires a little bit more planning, and then usually those are the people that are wanting to chronically come in and get those infusions.
So cool.
So side effect wise, most people tolerate these really, really well. The higher the doses go, you can start to have a little bit of nausea with infusion, and dry mouth are the two big things that I see. So I always tell people, make sure you have eaten before you come in. Those higher doses can actually start to drop your blood sugar a little bit. So if you come in and you've not eaten anything all day, and then I give you 50 or 75 grams IV, you can start to just feel a little bit off.
Okay.
So eat something before you come, bring a snack with you, bring some water, something to drink. Sometimes it can make your mouth feel a little tacky or dry feeling. But most people sail through just fine.
Now, if I'm having to carve some time out of my day, how much time does this take, a high dose vitamin C IV?
It depends on the dosage. Usually the 25 grams is like an hour and a half.
Okay.
And then 50 grams, we're looking at least, usually, especially at first time, I'm running it slower, maybe 2 hours, just to make sure you're going to tolerate okay.
So it does require a little bit of planning.
Requires some time. It's not one that I can just do wide open and throw it in. We've got to make sure you're tolerating it.
Well, this sounds fascinating. Robin, thank you so much for explaining
You're welcome.
this. Guys, that is high dose vitamin C IV. I have no idea if that's the order in which you're supposed to say it, but you can rewatch Robin in this video to see exactly how to say it. Robin, thank you so much.
Absolutely.
Guys, you name it, we explain it. As always, we'll see y'all next time.
Don't go away.